Hey everybody, this is Miss Shoemake. We're going to talk about sexually transmitted infections. Your exemplar is 19.5 for this one. All right, sexually transmitted infections. So not to make light of the situation, but this drawing is a good reminder that STIs can be very extremely painful. Even when they're not painful, they're going to cause damage, whether it's to relationships, to your bank account, to your pride, etc., etc. So we just have to learn how, and we'll talk about contraception later on in the term, but how to prevent STIs. All right, your book covers guidelines for safer sex. So we need to practice mutual monogamy. You know, if you're going to have sex, at least have sex with the same person. Do not engage in unprotected sex. Undergo HIV testing and retesting. Use latex condoms for all types of intercourse. Not lambskin. Lambskin are not as effective as latex condoms. We also want to lubricate the condom with water-based products, not oil-based. Oil-based will hurt the integrity of the condom. Okay? Do not use, share items that are contaminated with bloody body fluids. And we also have different kinds of, there's not only male condoms, there's female condoms too that women could carry. So sexually transmitted infections, what are they? Well, they're exactly what they sound like. They are transmitted through intimate contact through the genitals, through the mouth, through the rectum, also transmitted via blood or body fluids from mom to baby. Okay, they are transmitted through sexual intercourse, through any orifice. Okay, so it could be the vagina, it could be the anus, it could be mouth. I had a patient one time who had chlamydia in her stoma. Yeah, you heard me right. Her stoma. Okay, any orifice. I'm not joking. So risk factors. It can be because becoming sexually active at a young age, meaning you have more sexual exposure, more sexual partners, multiple sex partners, condom misuse, not putting a condom on correctly, or having a condom that breaks. Drug users have high risk, a risky sexual behavior, such as prostitution or sex with prostitutes. So basically, primary prevention is the key. Using a barrier method of contraception. Contraception is sleeping with the same person, not sleeping around, and universal precautions, of course, should be used with everybody. So the first STD that we'll talk about, STD and STI, I keep switching back and forth. They're now called sexually transmitted infections, but I'm old school. I still call them STDs. So I might be going back and forth. So I apologize. But the first one we'll talk about is genital herpes. Okay. This is caused by herpes simplex virus type 1 and type 2. Okay. It is a retrovirus, so that means it always is in the body. HSV1 and 2 can be found in and released from the sores that the viruses cause, but they're also released between the outbreaks from the skin and does not appear to be broken or to have a sore. So HSV1, as we know, is mostly what's called fever blisters or cold sores. We all have seen them. Okay, HSV2 is the sores on the genitals. So a lot of people are asymptomatic initially, and that first outbreak can be the most painful. Manifestations of herpes, we'll see itching, tingling, appearance of blisters, dysuria. DYS means painful. Dysuria means painful urination, and vaginal discharge. So again, because HSV ends in a V, which means virus, we cannot treat it and cure it. We could just treat the symptoms, but we cannot cure it. Reoccurrences can be triggered by stress, fever, sunburn, poor nutrition, menses, sexual activity. So, for example, for our pregnant women, there is no greater stress on a human body than growing another human being. Okay, even though the woman may not feel mentally or emotionally stressed, that is still a stress making another human is puts a stress on the body. So we may see outbreaks or reoccurrences of HSV during pregnancy. Transmission from mom to baby can occur. So a mom may need a C-section, especially for an outbreak. Now, some doctors I see, well, it's about 50-50. Half of the doctors will be like, oh, you have a history of HSV, let's just schedule a C-section. The other half is like, well, okay, you have a history of HSV, let's bring you in for an induction. If you don't have an outbreak, we'll deliver vaginally. If you do have an outbreak, we need a C-section. It really all depends. Okay, but again, that first outbreak can be quite pronounced. It usually lasts longer, has increased viral shedding. There may be fever, body aches, headaches, things like that. Okay. So the diagnosis, we take a history and an assessment and visual inspection of those sores. Okay. During the active outbreak, fluid from the vesicles can be sent for a culture. Blood testing or serologic testing can be done in between outbreaks. Treatment, antivirals such as Zovirax, Valtrex, these are common. These are specific doses for the initial outbreak, which suppress versus suppressive therapy. Okay, again, relieving the symptoms, and then we could educate, of course, to prevent that spread for the herpes. So, of course, we got pictures. So, HSV1, of course, is the cold sore, fever, blister, and then for the HSV2, which is genital, here's a male on the penis, and here's a female. Here's a vesicle here, okay. Can HSV1 turn into HSV2? Absolutely. So that's part of education we have to do as nurses, especially if you are young people, don't have oral sex if you have HSV1, and don't receive oral sex if your partner has HSV1. Okay. All right, genital warts. This is caused by HPV. Again, it ends in a V. It's a virus, meaning we cannot cure it. We could treat it, but not cure it. So it's caused by the human papillomavirus, transmitted primarily through intimate skin-to-skin contact. It can be also transmitted through a vaginal delivery. Depending on the amount, it may necessitate a C-section. And so genital warts, the warts can be one here, one there, one here, but they also can grow on top of each other, kind of like cauliflower or broccoli. And so in that case, that woman may need a C-section. As you know, and probably heard on commercials and stuff like that, it increases the risk of cervical cancer. Okay, so a woman really has to be, get her annual Pap test, and on a regular basis, so we can catch, that cervical cancer before it turns into cancer, when we just have cervical changes. Okay, HPV is the most common sexually transmitted disease. Manifestations, what does it look like? Visual inspection, we'll see pink, white, gray swellings depending on the person's skin color. And these can be anywhere down there, such as the cervix, the penis, the scrotum, the anus, and the perineal areas. I've also seen them on the inside of women's thighs. As I said in the previous slide, we may have precancerous changes of the cervix, the vulva, the anus, or the penis. So especially for a woman, we want to have her annual Pap test to catch it in the precancerous stage, or just those cell changes before it turns into cancer. How are we going to diagnose it? We're going to diagnose it through examination, looking at those visual inspection of those swellings, Pap test. Again, because it is a virus, there is no cure. All right? But we can treat it. So there is a vaccine, and although I just fixed this and updated this slideshow, but I forgot to put young boys here, and I'm so sorry. So vaccine, there is a vaccine, the Gardasil vaccine. It's against 4 types for young boys and young girls. We also have topical creams that may help shrink those warts, get rid of those warts. Cryosurgery, freezing, electric or laser cauterization, burning off the warts, and surgery to remove those warts, especially if they start growing on top of each other. The virus lives in the skin or the mucous membranes, usually causes no symptoms except for those warts. Condom use is strongly recommended because it is that barrier method which will help prevent the shedding of that skin. Okay, and having that shedding transfer from one person to another person. So, of course, I got pictures. So we see the genital warts on the penis on the left-hand side. Genital warts, this is the cauliflower or broccoli type of, where they all grow on top of each other. On the right-hand side, here's another penis. And then I know if you answer me, I cannot hear you, but what body part do you think that is? You guessed it, that's the anus. And so we can have genital warts around the anus as well. All right, chlamydia. This is caused by a bacteria, which, if we're going to look at the bright side, that is good news because we can treat bacteria with antibiotics. Okay? A mode of transmission is vaginal, anal intercourse, oral intercourse, contact with blood or bodily fluids, or during a vaginal delivery, it can be transmitted from an infected mama to that baby. Okay? This is often called the great sterilizer. Okay, because if left untreated, it can lead to pelvic inflammatory disease, which we'll talk a little bit about later. But we want to, of course, catch chlamydia in the beginning so it doesn't cause sterilization. So I got this picture from the CDC, which I think it's great. I like pictures, and I'm a visual person, so it can, in men and women, it can be asymptomatic, which really does stink. Okay, but for women, it can cause vaginal discharge, painful, frequent urination, bleeding between periods. We have our menstrual disorders. It says menstrual, but I can't believe that CDC. Pain in the lower abdomen, swelling of the skin around the vagina, the anus. In men, it can cause white cloudy discharge from the penis, painful urination, testicular pain or swelling, swollen skin around the anus, sore throat, inflamed eyelids, conjunctivitis, etc. Okay, so condom use is strongly recommended. Can cause, fatigue in both men and women. The patient can be cured with antibiotics. And I looked up why the CDC had this picture of a sauna. You cannot transfer chlamydia through a sauna. So maybe that's why they have it there. I'm not really sure, unless if you get down and dirty in the sauna. That's the only way I know you can get transferred. Every website I looked, including the CDC, said you cannot transfer during the sauna. So maybe they're just, I don't know. Use your imagination why they have the sauna there. This picture is really scary to me. Okay, this picture shows chlamydia rates of reported case by state and between 2011 and 2020. So on the left we have 2011, of course. On the right we have 2020. And the most important thing is if we look down here, what do those colors mean? The dark blue is the worst. So of course, Louisiana, we weren't doing so well in 2011. We're not doing well in 2020, but in 2020, a few states have joined, okay, in the darker colors. What does that mean? It means that we need to educate the public on the stopping of this of chlamydia. Okay, pass out condoms. Pass out female condoms. Alaska, that's also been dark blue, but it's really cold up there, so maybe there's nothing else to do. I heard it's a beautiful state, but the whole United States as a whole has turned darker colors. So we could fix that as nurses. All right, so the treatment for chlamydia. Treatment needs to be aggressive, and the patient needs to take the entire course of antibiotics. I'm going to say this for chlamydia, but this goes for all STDs that can be cured with antibiotics. They need to take the whole thing. Okay, um, if um, if using a single dose of antibiotics, the person should not have intercourse for 7 days after completing that dose, and they should not have intercourse while taking the antibiotics because they're not completely healed and cured. Okay. All pregnant women should be screened for chlamydia during that their first visit, so that during the beginning of the pregnancy. Treatment is usually with azithromycin. Complications: pelvic inflammatory disease, sterility, epididymitis, and prostatitis in men. And what effect does it have on pregnant women and the fetus? Well, it does increase risk of premature rupture of membranes, preterm labor, and delivery. An infant with infected during the vaginal delivery can get eye infections and even pneumonia. But that's why we give those babies that erythromycin ointment. Okay. Of course, I got pictures. So again, it can be like a yellow, whitish color, a discharge, both for men and women. Okay, this picture over here is looking at the cervix through a speculum. All right, gonorrhea. Gonorrhea is kind of like chlamydia's cousin. They do go hand in hand sometimes. But again, good news, it's caused by a bacteria. But this bacteria likes to grow and multiply in warm, moist areas of the perineal area. All right, and so gonorrhea, we do see gonorrhea in like the um, I can't think right now. The vagina, the rectum, and women will get tested for gonorrhea or STDs in that first visit with their obstetrician. All right. Again, it's signs and symptoms in males: burning sensation with urination, white, yellow, green discharge, painful swollen testicles. In females, painful urination when urinating, increased vaginal discharge, or even vaginal bleeding in between periods. So they may have some spotting going on. Also may cause pelvic inflammatory disease in females. All right, which may increase the risk of sterility. Both men and women may be asymptomatic. Again, here's our little CDC map. 2011, 2020, dark blue being the worst. And oh my goodness, look at 2020. The whole United States is almost dark blue. That is scary. Okay. Even Alaska was a lighter shade of blue in 2011. And of course, that jumped on board. But almost everybody is almost dark blue. Isn't that's crazy? So we need, again, we as nurses need to educate. Provide those condoms. Provide the female condoms. But it's and a lot of these darker colors are younger population. Teens are in that, can't happen to me, or if they are on treatment, they continue to pass it back and forth. They don't wait till the treatment is completed. Their partner doesn't get treated, things like that. So with an assessment, we're going to inspect the discharge, take a specimen of that discharge for testing, whether it's from the cervix, the urethra, the rectum, even the throat. Treatments are antibiotics, Rocephin, again, no sex until all are treated. And the effects on pregnant women and the fetus: it can cause miscarriages, premature rupture of membranes, premature delivery if untreated. So if contracted by the infant during a vaginal delivery, it can affect the baby's eyes. So again, we give that erythromycin ointment. Can even cause life-threatening blood infections. All right. So again, if a patient is positive for either gonorrhea or chlamydia in that first trimester, they will be tested again to make sure, especially during that third trimester, that they didn't get reinfected. Okay. Here's another picture of those manifestations. It's very similar to chlamydia. Again, discharge, dysuria. We'll send a specimen on for lab. We got pain in In the genitals, condom use is strongly recommended. Painful urination. Maybe we even have swollen lymph nodes, yellow whitish discharge from the penis and from the vagina from the females. We do need antibiotics. May cause conjunctivitis. Okay, we may need IV antibiotics, and it may even cause anal itching, depending on the area of penetration. Okay. All right, I got pictures again. The top left, it looks like chlamydia. I'll be honest with you, it's the same symptom. We got that white yellow discharge from either the vagina or the penis. Look at this poor baby's eye. So this baby has gonorrhea of the eyes, okay, and then the throat, okay. All right, moving on to syphilis. This is caused by a spirochete. Okay, and it's transmitted from person to person during with direct contact with a canker. Okay, or chancre, tomato. Sores can also develop on the lips and the mouth. Cankers usually develop at the point of entry. Okay, so if it's the point of entry is oral sex, we'll have the cankers on the mouth or the tongue. If it's vaginal sex, we'll see cankers, in the vagina or the penis for the male. So this is the primary stage. The primary stage will see that canker, and it's usually firm, round, small, and painless. I'll show you. I'm going to show you pictures in a second, but they look painful, but they're actually painless. And it appears usually around 10 to 90 days after an infection. Many people may be asymptomatic for years, again, which is kind of scary, yet remain at risk for late complications if left untreated. Heart disease, heart problems, brain damage, insanity, even death. All right. But what does it do on our baby? It may cause preterm labor, preterm delivery. Infected infants without treatment can develop brain damage, blindness, hearing impairment, bone and tooth abnormalities, even death. All right. All right. I got my map. Again, 2011, no dark blue. Not even Alaska. Alaska was at the lowest, at the white, okay, was at the lowest rate, okay. Jumped to 2020, oh my goodness. Half the United States is dark blue. Again, this is so scary, okay, and I even worry, about, young men and women who are not in a monogamous relationship, who are casually dating. This scares the bejesus out of me. Okay, so again, education is key. So we're in the primary stage of syphilis still. Here's those cankers. Now, if a man sees this on his penis, he's going to go to the doctors. Like, what the heck is on my penis? Again, but it's painless. So a woman may not inspect her perineum often. Like, how many of you look at your perineum, regularly? Okay, you don't have to answer that. But again, if it's painless, women may not know it's down there. So they're not going to get treated, is my point. Here we have the oral syphilis. We could see the cankers in the mouth here and the tongue here. If the canker is not, or the primary stage is not treated, we are going to go into the secondary stage. And this usually starts with the development of a rash. And this rash is not usually itchy. Okay, but we do see it on the palms of the hands. We may see it on the trunk of the body. It can appear as the canker is healing or several weeks after the canker is healed. The characteristic of the secondary syphilis is a rough red, reddish-brown spots. It's a maculopapular rash on the palms of the hands, bottom of the feet, the soles of the feet. And again, sometimes we do see it on the trunk. Okay, so here we see it on the trunk here. So a patient who doesn't know they have syphilis may develop this rash. Okay, money's tight for everybody right now. They just need to go to Walgreens, okay, and get some kind of rash medicine, cortisone cream, something like that. And again, eventually, this rash will go away, even if untreated. If untreated, it will go into the latent stage. Okay, the latent stage is hidden. When the secondary symptoms disappear, it may last 1 year to a lifetime. Then we'll go into the tertiary or late stage, where we see tumors in bones, the liver. We may have central nervous system and cardiovascular system involvement, because if you remember what I said in the beginning, it will start to go to like the heart, the brains. The brain causes heart damage, brain damage, things like that, insanity, even death. So again, people may not pick up these symptoms or think they're treating themselves with over-the-counter stuff, not knowing this is syphilis. But syphilis is wreaking havoc in the body, okay, and causing damage to the heart, the brain. And once it gets to this stage, we may treat some of the symptoms, but the damage is irreversible. Okay, that's what's so scary. Okay, for 1/3 of the people, latent stage will progress to the tertiary stage. I used to work with geriatric patients, and I remember having a patient in her 90s who had syphilis, and of course the disease was treated, the infection was treated, but at this point she had severe dementia and heart problems, and because it caused that irreversible damage. So with assessment, we're going to gather data, look at risk assessment, her, his or her sexual history, previous treatment for STDs, because a lot of times this isn't their first STD. Okay. A blood test, the VDRL or the RPR. I don't know if you noted this, but you need a VDRL to come to nursing school. So if you didn't get that call, congratulations. But I did not. When I looked to see, what the students needed in the state of Louisiana, you needed a VDRL. So there you have it. Treatment in women, if they're not treated before their third trimester, if they are treated before their trimester, the infants are usually safe and they're usually not infected. Okay. Okay, so I got a table for this one. The reported cases of syphilis among pregnant women and reported cases of congenital syphilis by year of birth. Okay, so the orange is pregnant women, all syphilis stages, whether it's the latent, on the primary, the secondary, or the latent stage. And this is congenital syphilis. And unfortunately, we're just climbing up. Okay, which is really sad. Some of these women do not have prenatal care, and again, everything's so expensive. Some people lost, their health insurance and may not be getting, tested and screened and having prenatal care. So it is very scary. All right, earlier in the lecture, I especially for gonorrhea and chlamydia, I mentioned pelvic inflammatory disease. Okay, your book really doesn't cover pelvic inflammatory disease, but I really thought it was worth mentioning because chlamydia and gonorrhea both cause it. Okay, it occurs when the organisms from the lower genital tract travel upward through that uterine cavity and into the fallopian tubes. Okay, so pelvic inflammatory disease likes that dark, moist environment. Okay, these infections are spread during sexual intercourse, even childbirth sometimes, even after an abortion, because of the instruments that are used can just deposit bacteria. All right. May involve more than one pelvic structures, the uterus, the fallopian tubes, adjacent pelvic structures. IUDs place a woman at risk, even though IUDs are sterile and they're placed under sterile procedure. It just takes one little tiny bacteria to enter and wreak havoc. Signs and symptoms of pelvic inflammatory disease are no to severe pain, fever, unusual vaginal discharge that may have a foul odor, lower abdominal pain. Okay, I know this is just a picture. It's not a real uterus or fallopian tubes that we're seeing, but it does depict of what the body goes through. So on the right-hand side, we have a normal fallopian tube. And If you've ever seen a fallopian tube in real life, they are the size of spaghetti. Okay, they are very tiny, very thin. On the left-hand side, we have pelvic inflammatory disease. You can see that inflammation, that swelling, the scar tissue, the adhesions, and you could certainly understand now why this may cause problems with fertility. Okay, with all this scar tissue and adhesions. Now, I do have to tell you a story. Okay, and so um, so I used to work in a OBGYN clinic, and I was assigned to telephone triage that one day. And telephone triage is exactly what it sounds like. Patients call in, they have problems, they're having, bleeding in between their periods, or, they have pelvic pain, or pain with urination, or they just want to make an appointment, so forth and so on. But this one woman called, and she's like, she was crying, and she's like, I have severe pelvic pain. I need to be seen today. Well, all the women that are listening, you cannot see your gynecologist today. You make an appointment weeks or months in advance. But we do have an amount of slots that are reserved for emergency cases. So I'm like, before I signed her up for an emergency case, I needed to get to know more about her. So I said, well, when did your pelvic pain start? Just a few days ago, but it's getting worse. She can't stand, like literally stand. The pain in her abdomen is so severe she can't stand. I said, well, has anything occurred to make this, like, prior to this pain, so forth and so on. So she did tell me that her husband has been away out of the country on a work trip, and he brought her home a sexual toy. And so they used that sexual toy, and ever since then, this pain has been increasing. So I'm like, oh gosh. So I'm asking her more questions. I don't remember what kind of questions I asked her because I was kind of in shock. But to find out, it was a wooden dildo. And when she did come in, the doctor put the speculum in her vagina, and her vagina was full of splinters. Yeah, you heard me correctly. Full of splinters. I know you're all clenching. Even the men that are listening are clenching. Dear God. So with all those tiny little holes from wood in her vagina, of course, it caused an infection, pelvic inflammatory disease, and she had to go to a surgery immediately. Now, when she walked in the office, I knew exactly who she was, just because the way she was walking, she had that pelvic inflammatory disease walk. So the pain was so severe in her lower abdomen, she had a hard time standing up straight. And so she came in, and she was kind of hunched over, holding her abdomen. And I'm like, that has to be her. And so, so my public service announcement for you guys is to make sure it's shellacked. Don't use anything that causes splinters, and make sure you clean it. Okay? You're welcome. All right, vaginal infections. So the first one here is trichomonas. Again, your book really doesn't go into detail, but again, we see these a lot in our patients, so it's worth mentioning. So trichomonas is a protozoal infection. Okay, so when you place it under microscope, you could see the little protozoa all moving around. It does play a role in pelvic inflammatory disease and infertility as well. The most common characteristic of this infection is a malodorous, purulent, green, frothy discharge. I'll never forget the first time I saw trichomonas. Again, I was working in that same office, and the doctor the patient came in complaining of itchiness and a foul odor. And so when the doctor put this speculum in, this frothy, fluorescent, not fluorescent, but like bright green discharge just came oozing out of that speculum. I've never seen anything like it. The itching and burning may occur. Dyspareunia, painful intercourse. There's that DYS again. Dyspareunia, dysuria, painful urination are common. Again, it's diagnosed by microscopic visualization. We'll see the protozoal. Okay. All partners will be treated with flagell. Okay. I just lost my place. Bacterial vaginosis. I'm sorry. Bacterial vaginosis. This is the most common cause of vaginal discharge. The discharge is thin, watery, can be a grayish, whitish color, and the most distinctive characteristic about this, it has a fishy odor. Okay. Candidiasis. This is yeast. Predisposing factor is a person on antibiotics, diabetes, pregnancy, obesity, high sugar diets, immunosuppression, and corticosteroids. So we're going to give an antifungal for that. And, oops, I'm sorry. Let me mention Group B strep. I thought I had it on the slide, but I guess I got rid of it. Group B strep, as you all know by now, you're so sick of us saying this, but it's present. It's a normal bacteria present in about 9 to 23% of healthy women, but it is associated with poor outcomes. I wouldn't really say it's a vaginal infection. It's just colonization of that this group, the Group B streptococcus in the vagina. So when the woman gets swabbed around 36, 37 weeks pregnant, they do have to treat her so that baby doesn't get sick, because there is poor pregnancy outcomes if that baby contracts it. HIV. HIV, what does it do? Of course, we all know by now, it gradually destroys that immune system, which makes it harder for that body to fight off infections. Causes are through sexual contact, through blood or bodily fluids. A pregnant woman can transmit it through her fetus through shared blood circulation or breast milk. All right. OB nurses love to, teach about breastfeeding. But this woman who has HIV or AIDS cannot breastfeed. She cannot, because that is transmitted through breast milk. Symptoms: diarrhea, fatigue, fever, muscle stiffness, aching, swelling lymph glands. It sounds like the common cold or even the flu. That's what's so scary. Okay? And so exams or tests, we do the HIV ELISA, ELISA, and HIV Western blot test. Both of these tests must be positive to confirm an HIV infection. Okay? So we know the modes of transmission are sexual contact, parental contact, perinatal contact. Risk for perinatal is approximately 14 to 45% for each pregnancy with an HIV mama. So remember, HIV can cross that placenta during pregnancy and exposure to blood, vaginal secretions, and that breast milk. And we also know transmission among healthcare workers. Needle sticks, sharps, a lot of needle sticks have that amount has decreased because we have a lot of needleless ways to connect our IVs, connect our piggybacks, things like that. So we have come a long way and decreased that amount, thank goodness. And of course, we need to use our universal and standard precautions. HIV treatment for HIV positive pregnant women. So once diagnosed with HIV, treatment is with oral antiviral meds to maintain that mama's health and to prevent the baby from becoming infected. During actual labor, okay, the mom will receive a loading dose of Retrovir through her IV, followed by a continuous infusion until she delivers. After she delivers, that baby is going to take that Retrovir in liquid form every 6 hours for 6 weeks after birth. That's a lot. Okay? And so that mom may need help. Okay? Because she may have other children. Or she's going to be postpartum, which means she's going to be tired and she's going to be in pain. And so we need to teach our other family members to help her out. Mom will resume her antiviral meds PO. Okay, postpartum. All right, so education. This is just another little slide I found on the CDC website, which I think is pretty significant. It's kind of mind-blowing. Okay, chlamydia up 1.2% from 2016. It went up. We don't like to see anything go up, but it did still go up. Gonorrhea, holy crap, 45% from 2016. Syphilis, 52% from 2016. Congenital syphilis, look at this, up 235% from 2016. I'm getting mad as I read this. Not mad, but more upset. We need to change this. If you work in the ER, women's health, public health, schools. I even, my husband is a high school teacher. I go, let me do this. Let me come to your school and teach. And he's like, I don't know if they'll allow that because they do have sex ed in the public education system. But this is what we need to, we need to scare the bejesus out of these people. Okay. And so they aren't contracting this. So they know how to safely have sex. So they know to see their doctor, when to see their doctor, and to finish that antibiotic, and not to have sex during the antibiotic, period. Okay, this is astounding to me. So what's going on in Louisiana? Well, we're not doing so hot. Okay, in 2019, this is the latest that they had. Chlamydia ranked number 2, and gonorrhea number 3, syphilis number 1, congenital syphilis number 1. Louisiana is the worst state for sexually transmitted diseases, the new report says. Oh, look at us. Come on. We could do better. Okay. This is from 2013. I couldn't find a parish by parish updated map, but 2013 was only 9 years ago. Okay. And so, where's New Orleans? I just saw it. Okay, New Orleans, dark brown. Okay, Baton Rouge. Where's Baton Rouge at? Okay, West Baton Rouge is dark. Wait, yeah, no, West Baton Rouge is lighter. East Baton Rouge is dark. Okay, some of you live in St. Tammany. It's a lighter color brown, but who knows what happened since 2013? Louisiana's just not really doing good. So again, education. This is HIV. These are our patients that we take care of on a daily basis. We don't know who has HIV and who doesn't. Sometimes the patients don't even know. So you need to protect yourself. Okay? There's this law that's pretty cool that passed in 2008. It's called the Expedited Partner Therapy. Okay? And when treating a patient with gonorrhea or chlamydia, when the provider gives a prescription of the appropriate antibiotic, they're going to give 2 prescriptions, one for their patient that they just saw, and one for their partner, even in the absence of a physical exam. This is to help squash that spread of, stop that spread of, of course, this was passed in 2008, but I think we need to use it a little bit more according to those maps that we just saw. Okay, so if a person comes in with chlamydia or gonorrhea, that prescriber is allowed to give them 2 prescriptions. Now, what is saying that person who was just diagnosed is going to give their partner that script? That's the problem. They may be too embarrassed to say, okay, I was just diagnosed with gonorrhea. You may want to fill this prescription. So that may be the problem right there, but we're trying. Okay. All right, so let's practice. Let's look at these practice questions. The nurse is planning an educational class for a group of 16-year-olds in the local high school. Regarding the transmission of sexually transmitted infections, the nurse plans to teach the students that the best method of preventing STIs is to what? Reduce the amount of alcohol, practicing abstinence, seeking medical help with early symptoms, or seeking testing for one member of the partnership. Okay? And you know this best answer. It's what your mama's taught you. It's what all our mamas taught us. Practice abstinence. Okay? Alcohol, I like number 1. Alcohol may have something to do with it, but we want to practice abstinence. That is the best method. When discussing responsible sexual behavior with a group of young adults, what would you emphasize? Remain in a long-term monogamous relationship, the use of animal skin condoms, oil-based lubricants for comfort and protection, or birth control medications to prevent sexually transmitted infections? And the answer here is remain in a long-term monogamous relationship. Basically, don't sleep around. Okay? We don't want to use animal skin because they're not the best. We want to use latex. We want to use water-based lubricants, not oil-based. Okay? And birth control methods to prevent sexually transmitted diseases. Well, that's not what we would emphasize. Birth control medications is a medication, so that's to prevent birth control, not really like the pill. That's not going to do anything with the sexually transmitted disease. That's just to control birth. All right, a client has developed salpingitis as a complication of gonorrhea. The nurse explains that this problem can lead to what? A shortened latency period, chlamydial infection, infertility, or reinfection. Well, first of all, what the heck is salpingitis? Okay, if you don't know what salpingitis, it's an itis, which is an infection or inflammation of something. And salpingitis is the fallopian tube. Okay, so this is, of course, we talked about pelvic inflammatory disease a little bit and how it can cause infertility. And so with the salpingitis, if the fallopian tube is inflamed or infected, it can cause that scar tissue, which can lead infertility. So the answer is C. A female caller calls to the STI hotline. She's crying, saying her husband is accusing her of cheating on him after she was diagnosed with chlamydia. What is your best response? What would you say? A, I can refer you to a marriage counselor if you think your husband would go. B, there's a lot of information about the chlamydia on the CDC website. I can give you the web address. C, there's no way to tell when you got infected because chlamydia often does not cause symptoms in women. Or D, you need to tell your husband that he's the one that cheated on you if you did not. Well, I personally like D, but that's not the answer. The answer here is C, because remember, it can, a man and a woman can be asymptomatic with chlamydia and gonorrhea, as a refresher. So the answer here is C. Okay, I kind of do like blaming the husband, but let's not do that. But C is the answer here. And our last one. Of course, I ended it with a select all that apply. Examples of sexual risk behaviors associated with STIs exposure include which of the following? Select all that apply. Okay. Fellatio. Now, I did have one young lady one time who timidly raised her hand and asked what fellatio was. So fellatio is oral sex on a man. That's just the fancy name for it. Okay. And I could call it other names, but it's oral sex on a man. Is that a risky behavior? Yes. Okay, so A is an answer. How about unprotected anal intercourse? Is that a risky behavior? Yes. So that is an answer. Multiple sex partners? Yes. Dry kissing. When I say dry kissing, kind of how you would kiss your grandma. No, that's considered a safe practice. And E, you all know E. That's a safe practice as well. So the answer here is ABC. Okay. And that's all I have, ladies and gentlemen. If you have any questions, please reach out to me and have a wonderful day.